Well, Jen, I applaud you because I don't hear this very often. Most of our colleagues are still stuck. So talk a little bit about what that was like breaking away. I mean, how did that break off come to where you are in a different setting right now?
Well, I kind of say too, like through my career, I had God moments. I call them God moments because I had like drip, 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 all this information. I didn't know what to do with it and didn't make sense. But I felt really strongly after I realized, overprescribing was taking place. I started, kind of taking patients aside and going against the pharma agenda and saying, hey, your mom is 80 years old and she's on atorvastatin 40 milligrams and she doesn't eat that much. So I'm thinking this is not helping her anymore. She should probably either talk to her provider and get a lower dose or talk about coming off. Now, I'm not, obviously, and you guys know this, we're not the providers. We can't advise people to stop a medication. That has to come from the provider. But I was trying to be that voice of reason in the ear of the patient to take that information back to their provider. Even I saw omeprazole, very highly dosed in a lot of these geriatric patients who were not eating the same food. And I kind of attribute that they weren't eating was because they're just popping all these pills, so their gut health is so destroyed. They don't even want to eat. They don't have the desire to eat. So that was kind of for me, I started realizing I need to break away from being in the pharmacy setting and actually go into the doctor's office and be an advocate and a voice for the patients because they don't know what I know. They don't see what I see. And we are called when we are shown something, we are called to act upon that, not to turn a blind eye. And so the end of 2019, I started doing a little bit of research and talking to some doctor's offices locally to me and asked if I could, participate and work with them and be a consulting pharmacist and try to help the providers in choosing which medications to prescribe. And I thought maybe this way I could stop the process before it started and only get patients on necessary medications. So I did come across a doctor's office. I was super excited, put my resignation in early 2020. By the time everything was rolling out, boom, here's right. And so I get the call that job was terminated and everything went telehealth. They didn't need me in the office. So I was on the sidelines watching things happen. And as I was seeing things unfold and watching everything that was taking place between masking, covering the ivermectin and hydroxychloroquine, pushing these injections, I literally one night sat on my sofa, looked at my husband and I said, I can't practice pharmacy again. He's like, what? He's like, we just spent hundreds of thousands of dollars to get you through college. You're going to walk away from your career? And I said, I can't do it to the people. I said, how can I go back in, stand behind the counter and dispense these medications? And I was going down rabbit holes. I was having fun because I was not working. So I was hearing what was going on. So I was doing some research and came across the Rockefeller Institute of Medicine, the Carnegie's, the Flexner report. And I went, wow, what is medicine supposed to be? What is health supposed to be? What is wellness? I just was waking up to really what was going on. And like those God moments that I talked about came full picture. And my husband looked at me and said, what are you going to do? And I said, I'd rather wait tables because I know that when I stand before God, he's going to say, you did the right thing. And, making that choice to say that, then he's opened up amazing doors. And it leads me to say this, that I thought I was supposed to work locally with the doctors to help patients. But now I'm working nationally with amazing doctors and helping people all over the world. So when you are obedient to what you're asked, God will open amazing doors.
Yeah, that's a wonderful story. And it's also an example of, Janet was mentioning some of our colleagues that are stuck in a situation. That's a choice. And, especially when they don't like it and they know that what is going on is wrong, they choose to stay in that job and they don't have to. There is something else to do. And one thing that cannot be taken away from us, is our knowledge. I mean, we have knowledge, and as pharmacists, we have learned a lot of cool things, and we need to be able to share that with people somehow, some way. And it doesn't have to be in a traditional setting. And, kudos to you for getting out of that.